we go. I just keep meeting the most fascinating people. I don't know what's happening, but I totally feel like it is the year of the nurse. All of these amazing nurses that have been on the front lines and actually doing having projects, creating businesses to help people is just astounding. And my next guest, her tagline is, I pick you up where the medical system dropped you off in my heart health accelerator cardiac wellness program. And guys, if you remember last week, Nurse Nicole and I, who is, helping to run the chest pain clinic program out in Central Florida. And then I was talking about all of the heart issues that I've been seeing. Well, here you go. Here's your solution. Mary Yuter. And I hope I'm saying that right. She worked as a cardiac ICU nurse at Bellevue Hospital in New York City for over 13 years. Both of her parents had died of heart attacks before Mary became a cardiac nurse. She began researching how to keep herself from becoming another statistic. And she observed that the medical system can save a life in an emergency, but then patients enter a treatment loop of doctor's appointments, meds, tests, refills, side effects, and more meds without any information, guidance, a plan, or understanding. Doctors and nurses simply, guys, just do not have the time, nor do they understand or are trained in other healing modalities. See, what happens is whatever area you meet your nurse in, that's where she's specialized. She's not specialized, or he's not specialized before that, like emergency, or after that, and primary care. So Mary's program is just amazing, and this is our first time talking. So welcome, Mary. Welcome to Nurses Out Loud. I'm happy to have you.
Yeah, Jody, thank you. I'm happy to be here. I feel like I landed in the right spot today.
You absolutely did. Well, I don't know. I think you had commented on one of my posts, I think. And then for some, I don't look everybody up, but I looked you up, and then I was like, oh my gosh, I need to talk to this woman. I also noticed here that you were awarded the Spirit of Hillman Award for Bedside Nursing Excellence, which is a really big honor there in the Hillman Foundation in New York City. So yeah. And your education is just extensive here. Yoga, plant-based nutrition, ICU, psychology. All right, girl, what else?
It keeps going. That's all I can say. I keep learning and keep going because things change, and I'm more of a holistic bent now these days.
What does
Completely,
that
actually.
mean, Mary? Holistic, when you're
Well,
talking about your patient.
holistic means that I teach the patient what they can do easily and in a natural way as opposed to the end of a syringe or a pill, because
Oh,
that's not where health is found. Health is found by doing things like, in order to lower your cholesterol and lower your blood pressure and improve blood flow, what's an easy thing you can do? You
mhm.
can have a garlic clove cut up, wait 15 seconds for the enzyme in it to convert to the blood thinning enzyme, and then eat it. That's one thing you can use. You can do all kinds of tactical strategies to make every meal your medicine, to decrease your blood pressure, decrease cholesterol. But what we really want to do is decrease inflammation, because cholesterol is actually not the bad guy. He's a good guy. He's trying to pave the potholes in the street of your arteries. So the LDL actually is a good guy in what your body needs, and the HDL is the good guy too. He's like, dude, you left asphalt all over the arteries. I've got to come clean this up, take it back to the liver. So our bodies are meant to process and use cholesterol in a certain way. When we're giving a statin, we're interfering with that process.
Yeah.
And now one of the things I like to do in my business is I like to ask provocative questions which promote critical thinking. So if
Mhm.
we're giving a medication that is blocking cholesterol in our bodies, and what organ in our bodies needs cholesterol the most? The brain. So
Yep.
if the most prescribed drug in our country is statin and it affects the brain, what now is another disease process affecting the brain that we're seeing a huge upswing in?
Alzheimer's.
Correct.
Yep.
So this, everything's by design. It's by
Hmm.
design. And then also you're creating diabetes because if you're impacting the cholesterol, you're impacting vitamin D. Vitamin D helps the other hormones and including insulin. So if you're impacting insulin, you're now creating diabetes. And statin side effects are diabetes. Um, and then it interferes with your CoQ10. So then you get all kinds of muscle involvement, including the heart muscle, so they can lead to heart failure. So
Hmm.
the very med you're taking is actually the med that's going to kill you.
Well, and
And
let's talk about statin for a little bit. You know, the history of it, like when did it come out? How did it come out? Are you familiar with that part of it?
I'm not familiar with that part of it. No.
Okay, so I had did some research on statins, and basically they came out overnight back in the 90s. It was this faulty study that said that cholesterol is the killer, right? And we needed to lower people's cholesterol. Remember how they like took away butter from us and they pushed the margarine and then they made everything fat free snack wells. And then all they did was increase the sugar. Remember, like those days, 80s, 90s is when I believe this
Mm-hmm.
was going on. But anyway, the statin, and then basically overnight, millions of people were on this statin drug, and my dad was one of those patients. And I was like, oh my gosh. I mean, I obviously I didn't know all of that back then, but when I was listening to this, you know, it was just another marketing ploy, the
Mm-hmm.
same as the MS Cotton, right? The same as what they do with all the other, you know, drugs that they want to push. Even how about omeprazole? I mean, everybody's on that. My dad's been on that since he was like 32 years old for 40 years, you
Oh
know?
my gosh.
Yeah. And then the statin drugs. But yeah, when I learned about it, there was this picture of the arteries, right? And then the arteries were like, you know, like breaking apart, and or like inflammation was causing holes in the wall, right? And then here you come and you have cholesterol, patch it up. Like you were saying, like the cholesterol is good and we need it. And the fact that we have tens of millions of people basically overnight just on a statin drug, is just it's another big pharma thing.
And what they used to do, the high used to be 300. Then the high was dropped to 250 before you got on a statin. Now they've dropped the high to 200.
Right.
So if your cholesterol is 200, which is totally a great cholesterol, you can have a cholesterol of 300 and be healthy. Your body actually is making that for a reason. Maybe what we need to look at is your inflammatory process and what you're eating.
Yeah.
But what it is it's I call it sad, sad Sam, and I've actually added on to that. But the standard American diet leads to the standard American um, drugs, diseases, which leads to the standard American medications. And
Mhm.
those are brought to you by the standard American media, which is sponsored by the standard American pharma.
Oh my gosh. That's
So there
right.
you go.
There you
Yep.
go.
Yeah.
Wow. Well, you know what else is there, like when we talk about the number, vitamin D? I'm, you know, we say in healthcare that a vitamin D level of 20 is normal, whereas there's a lot of evidence where it should be between 60 and 80.
I think higher is better. And
Yeah.
what's happening though is people are taking just D, just the little cholecalciferol capsule. And when you just take D by itself, what you're doing is you're taking the calcium and loading it into your arteries. If you have D plus K2, the calcium is going to go into your bones and teeth where it belongs.
Mm-hmm.
So a lot of people are taking this vitamin D and actually exacerbating their cardiac conditions or their cerebrovascular conditions.
Oh, really?
Yeah. So if you have an inflammatory, say you eat a lot of seed oils, so
Okay.
you've got inflammation of your arteries, including your heart and your cerebral arteries, and then you're taking this vitamin D without K2, then you're taking that inflammation and then putting the calcium in it and calcifying. And
Well,
this
I
can
was
also lead to
looking,
Alzheimer's.
yes, yeah, absolutely. I'm actually just looking up right now. K2. I remember when I was researching it, it really doesn't take much to get the appropriate amount of K2 in our diet. So I'm not sure if we need to supplement that, but I'm looking at it like spinach, kale, broccoli. No, that's no, hold on. Chicken breast, cheese, egg yolks, butter, salami, ground beef. So I think that's what I'm saying. I think that people mostly get enough of their K2 in their diet, but I haven't really looked at it too much, but I hear you. I hear you. Like, we need to make sure that it's like converted properly and effectively and stuff.
Exactly. Yeah. So these are the kinds of things that you can do holistically to make great changes in your health.
Mm-hmm.
And the thing is people aren't told these things. So, for example, today my Instagram post was about mindset. And it's like, well, why is mindset so important? Because your body and your cells are listening to everything you think. So if you're suffering like a typical cardiac patient or a patient who's ill
Mm-hmm.
with depression, worry, fear, anxiety, even PTSD. So say you had a heart attack in the middle of the night, you're you're going to have anticipatory fear of another event
Yes.
happening. It's going to be hard for you to go to sleep at night. So all of these thoughts and feelings convert into chemicals in our body in the form of hormones.
Mm-hmm.
And when this is happening to you, your cells are listening to everything you think and responding to all those chemicals. And so starting with mindset is so important because if you just start saying, well, you got to do this and you got to do that, you have to click in. It's like going skiing. You have to click your boots in. You have to click into the skis. So
Yeah.
this is your mind getting clicked in before you do a program or start to prepare for learning. And so mindset is really important. And then moving on to preparing your gut. These are my protocols. Preparing your gut. Well, why is the gut important? Because, as you know, it's your immunity.
Mm-hmm.
And also, if your gut is not a healthy place for your good bacteria to thrive, then you can eat all the healthy food you want, but you're never going to absorb it. If you have
Yes.
leaky gut, if you
Mhm.
have ulcers, so the gut health is really important. Making it a hospitable environment, seeding it with good bacteria, and then feeding. It's like having a pet. You got to feed these bacteria, right? You got to populate them and then let them thrive. So that's the next thing. And then moving on to detoxifying, because from the air we have and breathe to what's in the sky that's being sprayed to our water supply, to our food supply, to what the animals eat, um, and to what we're ingesting unbeknowingly, like glyphosate, we need to detox our bodies. And a lot of that has to do with heavy metals as well. So that's really important. And then tactical strategy for nourishment so that what you're eating every meal serves as your medicine, and it can. And you
Yeah.
can still enjoy your food. You can still enjoy your food. And then also you know, I don't think we should be punitive. You have to live before you die. You want to enjoy, you know, that chocolate souffle or what, enjoy the heck out of it. You're gonna have bacon, go have it.
Yeah.
You know, a day or two of just completely living in food hedonism is not going to set you back. And so many people just, um, I don't know, they're living in the word diet is just so constrictive and punitive. And I
Mhm.
prefer to use the word nourishment. How are we going to nourish our body? Think about a plant. We're like plants. We photosynthesize. I'm photosynthesizing.
Right.
Um, and we take our food and convert it, and it goes into our cells like plants. So, do you go up to your plant and pour in Pepsi? Do
Right.
you throw in McDonald's hamburger? No. And so our bodies are the same way. They can't survive on that kind of stuff. And that's what makes us sick. And years and years and years of that. And then people want to know, well, how do I lower my blood pressure? Well, you're asking to play whack-a-mole with blood pressure, but something else is going to pop up. It's a systematic way of working with your body to heal it naturally. So the ultimate goal is habit stacking, a week at a time, adding on new habits so that by the end of 9 weeks, you have built the new life dash style that doctors say you should have. This is positive habit stacking. So at the end of those 9 weeks, you have compounded health benefits. And where do those show up? In how you feel
Hmm.
and in your lab work. That's where the real rubber hits the road, is your lab work.
Yes. And so with your program, is your program a 9-week program?
It is a 9 week program. I built it out so that you have access for 18 weeks. And if you're still milking it, you can keep signing on. Um, and in that 9 weeks, it's meant to take slowly. So 18 weeks, that's fine. Take your time, marinate in it, implement the steps. And there's homework assignments. And the
Hmm.
homework is like watching What the Health, which is a movie about the politics behind our food supply, very enlightening. Or Fat, Sick, and Nearly Dead, about this guy, film documentarian that ate McDonald's
Yes.
for
I
30
remember
days.
that.
And yeah, he almost died. And then I think he did one called Super Size Me, where
Yes.
he had to ask for everything to be supersized and eat it. And his doctor said, "You're going to die. You're going to die if you do this." And it's suicide by food.
Uh-huh.
And yeah, so it's 9 weeks, but you have the ultimate luxury of taking 18 weeks, taking your time, really marinating in it. I love when people bring their partners in with them. I don't mind that at all because you have support. And then also the first and third Wednesday each month. In fact, tonight is the first Wednesday. I have a meeting later on tonight with the folks in my program, and it's a built-in support network. So this is other survivors now thriving, welcoming any newcomers. And each time we have a little lecture on something. Tonight we're going to go over case history of one of my clients who we thought, oh, great idea. You know, let's go get a repeat echocardiogram and see what's going on with your heart 2 years post heart attack.
Okay.
And he went in and they said he had arrhythmias, and they had him on the table for an ablation,
Hmm.
and they didn't look at his labs, and they aborted the procedure. So he was on the table, they started the procedure and aborted. So this is medical error, which is one of the leading causes of death, unnecessary medical error. And what it was he had been on statins, and one of the things that statins can do, as we talked about, is interfere with your hormones. So
Hmm.
his thyroid, he was hyperthyroid on his blood work.
Um,
And what does hyperthyroid do? Causes
makes you,
arrhythmias.
yeah.
So they put him on amiodarone, which is an antiarrhythmic medication, and wanted to do this procedure when neither had anything to do with the root cause of the problem.
It was his thyroid.
So we're going to talk about that case history tonight.
Oh, I
In
love this.
yeah,
This
yeah.
is so great. I want to hear more about how you came, like how did this come to be? Because you started this in 2019, your
I did. I got
program?
a phone call from one of my best friends. She was my college roommate, and she said, "Mary, I have to have open heart surgery. I'm scared to death and I don't know what to do. And the doctors just say you'll be fine." I said, "What is going on?" I said, "First of all, I got you. We're going to get you through this. No problem." And what happened was she had had a cancer 20 years prior, and they had radiated her chest, and they didn't have the technology to isolate the beams and target the area that they wanted to radiate. So they inadvertently radiated two of her heart valves.
Oh,
And now
wow.
she'd had respiratory failure twice from her heart valves not working properly and had been intubated twice in the hospital. And so the doctor said, we've got to replace your valves while your heart is healthy enough to receive them. So imagine feeling like you do today or like me today, and someone telling you, well, we have to crack your chest open, and this is a surgery that people die from, but
Right.
you need these new heart valves. And crazy. So I helped her pre-op prepare her body because we had the luxury of a little time because it was an elective surgery.
Hmm.
And we prepared her body, we prepared her lungs, we worked with an incentive spirometer. We got her lined up with all kinds of essential oils for her recovery. Um, I also wrote up what her family can, she created a little plan of who's going to bring over food, who's going to do what on what day. Um, she made a new infirmary, like her bedroom. She redid it and had
Oh,
everything, all her comfort things there. And I went through what exactly you need when you go to the hospital, what you need to take, and what you're going to need when you get home. And for example, are you reaching up to cupboards? No. So have everything down. Can you unscrew a brand new jar of pickles? No. So have everything loose. Have everything within reach. And then we had amazing husband. He never left the hospital the whole time, the whole week she was in, chronicled it. He is a Green Beret Reserve, so it was like Operation Nuevo Corazon, Operation New Heart, and
I
they just
love that.
we just had the whole thing scheduled out, and it was fantastic. And the night before, she had a party, and it was a send off party, and so everything was done so positively and lightly. And so that is how I chronicled my book. I wrote a book, and that is what the book is. After the book, I developed my program because the book does not have all the protocols for all the steps I just told you. It's a basic primer. It'll help people that can't afford the program, but the program is really where the true reversal and healing is going to occur. And especially with other people helping you, support is so important. And some people are going through this alone and don't have anybody to turn to.
I know I received a couple of emails just very recently saying, I hear you guys talking about the nurses that help people. I live alone. What's that name of that program again? And, it's Remnant Nursing, which I also want to connect you with Kimberly, because I think being a part of remnantnursing.org.
How do you spell remnant?
REMNANT, remnant. Why do I feel like
Because it
I
could be
can't spell?
remnant. Yeah, it's
Remnant, remnant. Yeah, REMNANT.
nurse.
Remnantnursing.org. And that's like a private membership association where nurses can come in and care for the people that need the help. So they purchase hours is what they purchase, like blocks of hours, 6 hours, 10 hours. Not sure like how much, but it depends. Do I want to work on my heart? Do I want to work on losing weight? What is it? Or is that person in the hospital and now they need you to come? Essentially just what your friend did, Mary. Not everybody has a nurse best friend.
Yeah, I was
So,
cross country. She's in California, and I was here. So
right.
yeah, but that's true. Yeah, and yeah, we did some cardiac yoga too. I made a special cardiac yoga for her to recuperate because you can't open your chest right after open heart surgery. But we
Hmm.
did work on opening it, heart openers before surgery, so that she wouldn't be as cranky afterward. And that was really fun. So I learned a lot from that, and I've learned that the caregivers are really overlooked. And I made a special chapter in my book for the caregivers on what to expect when you see your loved one in the hospital, because you're looking at ventilators and IV lines and A lines and drips and blood draws and X-rays and
Right.
echocardiograms, and you don't know what's happening, and your loved one doesn't
Yeah.
look like them.
No, no. I
Does
mean,
not look like.
I worked as a tech in the ICU and we got hearts right after. And I remember, I mean, it would take 45 minutes with the nurse just to get the patient up to sit in the chair right next to the bed. And that's all they could do. And then, it's they're connected to so many lines and stuff. Yeah,
Yeah.
it's a big deal. So work like yours is just so important. I want to get more into what your program is like, because I think that this would speak to a lot of people, that have, I mean, I think it's like 70% of Americans are on statins.
Yeah.
It's a lot of people. So
Yeah.
I want to get more into that, and then also get your opinion on, what you're seeing these days, how you feel like the world is going, because we briefly talked before we came on air, but it's very interesting because you and I had just met. And I think this is just another testimony to how many of us there are out there. It's pretty wild. So
Truly, truly caring nurses about the health and well-being of their client slash patient. And yeah, in the medical system, you can't do the things you would like to do, and there's no time. And, I used to wear essential oils to work too, like specifically lavender, and I would splash it on the doctor's white coat so that they would calm down and they would populate room to room, and I would wear it on myself, and that helped calm patients and calm their families. I mean, there's so many things we can do, but yeah, for my program, um, we start with a consultation, either that
yeah,
or
let's hit that up right after the break. First, I want to give a shout out to our sponsor, ASEA. ASEA is one of the only supplements out there for cell redox signaling molecules that help at the cellular level. I had just completed a fast this week, guys, and mine was more for spiritual reasons, but I incorporated the ASEA in there, and actually my hydrogen water bottle that I just got. And I just cannot believe how much more energy I had going through this fast. It just is amazing. And another person with the skin issue, something was going down. She was getting a sore right in her groin area, and she thought she was going to have to go get it lanced in the emergency room. And she put on the ASEA redox gel, and it went away after one application. So you hear me always giving personal testimonies on these products, and I mean them. So go check out americaoutloud.shop and get the exclusive discount for America Out Loud Talk Radio listeners. And we will be right back after the break. Welcome back. You are listening to Nurses Out Loud, and I am your host, Nurse Jody O'Malley. I am here today with Mary Yuter from heart2soulcw.com. That is heart, TOSOULCW.com. And Mary was a cardiac nurse at the bedside, and in 2019 decided to open up her own business teaching patients about heart recovery after heart surgeries, or after just even getting diagnosed with high blood pressure, heart issues. Mary is the nurse for you, and we are going to get into her program a little bit more. So yeah, Mary, why don't you tell us a little bit more about it?
okay. And I actually had some redox on my face today.
Oh, you know what? You've
Yeah,
tried it
ASEA.
before?
I know it. Yeah, yeah.
Yeah.
That's great. It's good stuff. Yeah, yeah. I was smiling the whole time. So yeah, so my program, one of the things in the medical system is you're a number. And when you're discharged, you are now going from doctor's appointment and prescription to prescription refill to a follow-up recheck to your doctor. And doctors have 15 minutes to spend with you. And how on earth is that going to actually move the needle in your care? And you're continuing to stay on these meds and then sometimes get side effects from the meds. So now you're a pharmaceutical customer for life. So for people that find themselves in this treatment loop, one of the things that you want to do is ask your doctor, what is the rationale for me to be on this medication? Why do you want me to be on this? Most people don't know why. And number two is, what's the plan to get me off it? Because does a healthy person need to be on meds?
Right.
Is your body deficient in beta blockers, statins, GERD meds, blood
Right.
thinners?
No.
No, your body's not deficient in that. You don't
Yeah.
need to supplement with medications. So those are the two big things. And
I really
then
do like you, having the patient ask their doctor, like, okay, if you're having me on it for cholesterol right now, when am I going to be able to get off of this? My dad's been on it for 40. Everybody's on it. They're a lifelong customer. There is no plan to get you off, but it would be interesting to see your doctor squirm when you ask him that question.
yeah, they can't answer that. And it's just that's what they're trained in. Unfortunately, and I'm not blasting the doctors at all, they're trained to diagnose and prescribe. And then they're in this, this loop of only being able to see people for 15 minutes. And it just must be so scary being a doctor and having that responsibility. And what we really want to do is empower people to take charge of their own health by education, by understanding how they got sick and what they can do to make them well. And I like to meet each person one-on-one, either in a consultation, which you can book on my website, or um, in the program, you'll book your appointment with me. Once you go in, there's a special link.
Mhm.
And I definitely want to know what your labs are and any test results and your history with your heart and then medical history and about you, because as we talked about mindset, like if you're in a stressful relationship or you have a child who's a special needs child and you're raising that child alone, or whatever the outlier things, those are all things that are impacting your life in some way and are going to impact your health, overall health, and heart health. So then we work on the mindset. And I had one client who said, told his wife, I'm not going to meditate. I'm not going to try these mind things or breathing or and she said, well, then why did you sign up for this program if you're not going to do it, and follow her? And so she came with him the first few meetings, and now he says, Mary, I cannot go through my day. It's not a good day unless I meditate. I have to meditate at the start of each day. And I mean, my clients are my heroes, my patients are my heroes, because they take it and run with it, and
Yeah.
sometimes so much better than I do, because they have had an event that they don't want to have another one. And I specialize in heart attacks, and here's the scary thing. Most people have their second heart attack within 5 years of their first, despite doctor's appointments and medications.
Mhm.
And why is that? Because they're not doing the things that are going to make change in their overall body and help, like the mindset, like the gut healing, like the circulation protocol. And one of the things I like to do is a case history of James Gandolfini, one of my favorite actors, and his heart attack, and what could have been done differently to mitigate what happened to him.
Yeah.
So,
I'd like to hear that. Do you want to talk a little bit about that?
sure. So, off the cuff here, I don't have my lecture notes,
Sure.
but this is a man who was a big guy, and so could have been diabetic. We don't know. Could have had heart disease. We don't know. Could have had diabetes. But that's like the Bermuda Triangle right there of
Uh-huh.
cardiac disease. Yeah. So let's say he went on an overnight flight. So when you're flying, you're supposed to walk because you're at risk for
But
DVT, for your
mhm.
blood clotting. So let's say he slept, and let's say he did not hydrate really before the flight, and he slept, so he wasn't continuing to hydrate. And then he got off the plane, and based on his condition, if he was diabetic and had thick, sludgy blood at this point, and because of his nutrition, maybe he had a lot of extra saturated fat on board, And then he went out that day and then to a huge dinner where he had, oh my God, deep fried calamari. He had just tons of saturated fat, and he had something like 8 cocktails, like beer and 6 cocktails, something like that altogether. And then he had a cigar. So he just loaded up his
Sounds
system
like
with
a
all.
good time.
I'm sure he was a great time and had a great time. But you can load up your system like that into a perfect storm of the plane. I don't know how many days or hours he had been off the plane, but there's things you could do to mitigate. So the day before, you start really hydrating before your flight.
Yeah.
You wear compression stockings on your flight. You set your alarm if you're on an overnight flight and get up and walk and really hydrate so that your body's waking you up to pee in case you sleep through your alarm. And then when you're getting off, to be mindful that you're still dehydrated and eat nourishing and foods that are full of fluids, like salads and apples and oranges and things like that. And then kind of take it easy, not go so overboard, excess in moderation, let's call it that,
Yeah.
instead of excess and excess. So little things like that could have made a tweak in what happened, but I think it just all came together
Yeah.
in one big, huge mess. And that's so unfortunate, because we have our arteries, and that's what that looks like when you're talking about all that. So how can your blood cells get through there
Yeah.
versus those are what healthy arteries look like,
Right. Right.
and and so also
Like
eating
a,
foods high in nitric oxide like beets and leafy greens could have
mhm,
helped vasodilate him.
mhm.
And then shamelessly, but a little plug, I'm a distributor for a medical device called Beamer. Do you know of it?
I have heard of it. I believe Kimberly was telling me about it. Go ahead.
Yeah, it's a special pulse electromagnetic field device. So, like we have EMFs all around us that are harmful, such as oxygen in the hospital is harmful, right? If you're on a ventilator, 100% oxygenation, what we're trying to do is antioxidant. Oxygen grabs molecules off of other molecules in our body, and oxygenation also oxidizes. It causes rust in our body. So oxygen can be toxic, and so can EMFs, but EMFs can also be helpful in a medical capacity. And Beamer is the only pulsed electromagnetic field PEMF device that is class 2 medical. Class 1 means does no harm. Class 2 means the studies are there showing that it does what it says it does, meaning it vasodilates, improves blood flow, increases oxygenation and nutrients to the cell, takes away toxins. So when you have creaky joints and things like that, that's like the sludge that's built up on top of a pond. That's in your joints, and this helps to open up all those everything to the microvasculature and help the blood flow. It's 8 minutes of lying on a mat. You could do your meditation while you're on your mat, and it keeps the blood flow going for 12 to 18 hours. It's most important to do it at night. Why? Because stasis, our blood's not moving, we're not circulating. So that's another 12 to 18 hours. And what you're also doing is you are allowing your white blood cells to go on patrol because they're stuck in all these areas that are jacked up with clots, with cholesterol, with whatever. So here we're opening everything up, and your white blood cells, your immune system is getting a little boost. So this is excellent. A lot of pro athletes use it for muscle recovery. San Francisco 49ers use it. So if they win Sunday,
Oh.
that's their little secret weapon. Tom Brady uses it. Um, the Navy SEALs use it.
How
I
much
use
is
it.
this?
These are almost $6,000.
Oh, wow.
Yeah,
Wow.
but you are doing something that nothing else can do in your body, and that's opening everything up, increasing blood flow. And when you're doing that, what's it doing for your heart?
Yeah, I mean, it's providing more oxygen. Yeah,
Yeah, and taking the pressure off the heart. And
right.
we heart disease kills more people than anything. It's reversible and preventable, and it's still killing more people than all cancer combined. Why
Right.
is that? Because
Yeah.
the right things aren't being done. And this is something that is the cherry on the sundae for any cardiac patient, as far as I'm concerned. And I have the contraindications on my site. If you've had recent DVTs, if you've had a recent surgery, if you've, they're listed on my site, but there are certain, not that many, but certain contraindications where you wouldn't have it. And then you are personally instructed by me when you buy your unit, because you want to make sure that you're using it properly, because it is a medical device. It is using pulse electromagnetic energy, and you want to make sure that, or we want to make sure that you're using it properly, and have a little unboxing party.
Oh, yes, of course.
Yeah.
Are you taking data on people that have had the injections?
I'm not taking data, but I am helping them, because there's myocarditis, pericarditis, inflammatory vascular conditions, immune system conditions where all your white blood cells are off. Uh, I have on my website, I have a client who had 199 over like 110 for his blood pressure. And that was after he got the shot. And he went to work immediately, and his immune system was wiped out. And he had this feeling of, as cardiac patients do, of impending doom. Like, something's going to happen. I'm so worried. And he could have stroked. He could have had a heart attack. And he chose not to go to the hospital. He did not want to go to the hospital. And that was a risk, but we got to work right away. He found me, and we got to work right away, and went ham on everything, just went hardcore. And he's now in the 130s, over 80 to 90, and his immune system is back in check. He also had a fourth heart sound. So he had this extra heart sound happening.
Oh.
Yeah, and his echocardiogram came out weird. So these are some of the things that I'm seeing. And then there's also a lot of people just sudden death.
Right.
And the sudden death is, or could be, where the heart, and it happens to athletes on the field. And I'm wondering if it's something to do with adrenaline, or it is, I was looking at Dr. Peter McCullough, and he was saying that it could be where the heart usually takes fats for energy, and it is now taking glucose. It has changed the way that it is operating, and that can trigger some kind of metabolic event for the heart. Yeah. So it's unknown. Also, the DNA is being rewritten. So say you have dog ate cat, it's shifting things over. So it might be God, Tay, Tack. So our DNA is getting rewritten by what's going on in this transcribing. And this, I think it was, this disease was created in order to get that into people for whatever nefarious reason. I don't know.
Yeah, I don't know. How did your family and friends receive you?
They're probably tired of hearing me talk about things, but a lot of people, including family and friends, are in denial. They think this is conspiracy, and the proof is all out there now. The proof is all out there. Now, nothing says trust the science more than we're not liable, right?
Right.
So if nobody's liable, how can you trust the science?
Yeah, right. Exactly. Like you're just saying, you can say whatever you want and you're not held accountable for it. It's pretty wild. I know you live on the East Coast, and that's primarily a Democratic, for lack of better description, I guess. But again, a lot of people did go down that rabbit hole. I would say, I was looking at it. I was looking at Kaiser. So somebody sent me Kaiser Permanente. Someone sent me, and I was waiting for the validation of it. But Kaiser is rolling back their mandate, even on coworker or even on employees. So new employees don't have to submit to get a shot. They're not coerced into doing it anymore. And they have 240,000 employees. Back in 2021, it was 240,000 employees they had. And
Imagine how much pharma made on that company alone.
that's what I'm saying. But yeah, just on that company alone.
And then the companies were fined for anybody who didn't do that. And, you know, not to fault people, people made were forced into making a horrible decision and do something they didn't want to do. Or the propaganda was making them believe that this will help protect my grandma.
Mm-hmm. Well, I think it was from the numbers that I was reading, there were 30% of the people that came out right away and got shot at Kaiser, right? 30%. And then the other 70% did not want to take it. And then another 40% finally succumbed to the coercion and took it. And then at the end of the day, only 20 or 2,200 people got fired, either got fired or walked away from the job. You look at that, you had 70% of people. That is what, 70, 140, 21. Well, I don't want to do math, but like 160,000, say 80 or 70%. 160,000 people did not want to take it, but they did. But they did. Only 1% said, no, I'm going to walk away.
And this was 90 something
wild
it was survivable. And
Yeah,
this was a test to see,
it
like,
was a test.
if like your mom always said, if everybody jumps off a cliff, are you too? Are you going to be one of the sheep jumping off? So this was a test also in certain people. I know I lived in a high rise. It was a 34 floor high rise, and with over 1,000 people, and everybody, that was the talk, and it was a lot of the virtue signaling of, oh, I'm going to get this, you know, I'm going to do my part, without people even thinking, what are the ramifications of this? What if something goes wrong? Am I protected? Can I sue?
Right.
Nothing. And then these companies were fiscally fined if they did not comply. So the companies were pushing it and saying, you're considered resigned if you don't get it.
Yeah.
Not even no unemployment. You resign. It's our rights were completely, that's the thing that now that we have to really watch is our rights, because laws are being made left and right, and they're superseding our constitutional rights.
Right.
And and
Scary.
and like in New York, they said that they can take you at any time, at any age, and for whatever reason, that they think you were uh, exposed to something or that you have something, even if you're healthy, and put things in your body. So it's violating all of our constitutional rights.
Yeah.
And there is a great gal that's running for office, and those are the people that we have to support, are those kind of people that are standing up. There's not many of them, though. And the problem is that the government was never supposed to know anything about us, but we were supposed to know everything about the government, and it's backward now.
Right. Right. They
And
know way too much and they're using it. They especially now know the psyche of a lot of people. Dangle their paycheck and over their head, and they're going to do whatever we tell them to do. You know, I mean, I'm not sure if you're, if know the Bible or anything, but even the book of Revelation talks about the mark of the beast and talks about the number 666, that if you do not have it, you're not going to be able to buy, sell, or trade anything. Now I look at that and that's real, that would be a real thing. You cannot go to the store. You have no money, your job, there's no cash anymore because it's all digital, right? And you see that with how many people just will succumb and take that. based on what they did this go around. I don't know. I don't know. I mean, but I definitely believe it's a war of good versus evil, you
And
know?
here's another thing to think about. Do you know how it's called predictive programming? So here's a mind-blowing thought, and it's I do believe in the Bible, but what if that is also predictive? Because what's been happening is in there.
Yes.
So is this part of it? Like, what is that factor in all this? Like,
Oh, like you're saying, like, what if the Bible really isn't
is
the Bible? Yeah. Right. No, I mean, that's where, I look at the Bible and I see that it is 25% prophetic in nature. And all of these things have come to pass, a ton of things, right? Even Jerusalem, like, or Israel, people coming back to Israel. It was a dead land. And then all of a sudden now it's this, booming with vegetables and flowers and some of the smartest people. Everybody that tried to wage war against it loses. And so, I mean, I believe the Bible is real. I've seen God's hand move many times in my life. And if you look at, that's the antithesis of everything that's out here. It's
oh
one
yeah,
thing.
miracles happen. Miracles happen.
Yeah. And
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 I
it's the
think,
one thing that hasn't been disproven. You know what I mean?
yeah,
They try to disprove the Bible, but they can't. And yeah, yeah.
but it's a mind-blowing thought. I
It
just,
is a mind blowing.
again, the provocative thought to have a conversation around. And I was just saying to my guy AJ that it's not that we should avoid the topics of politics and religion. It's that we should have thoughtful conversations and
Yes.
really just dig in and analyze and question and have that conversation.
Yeah.
Because I was always a Democrat, but I think now Republican is a Democrat.
Hmm.
It's like the Republican beliefs seem to be democratic in what used to be democratic. So it's crazy. But then again, what is that all about? That's a whole nother topic.
But I do love that you brought that up because obviously you can sense where my heart is, and you still felt comfortable to bring up something that's provocative like that. And the way I responded was, like how a normal person should respond. I had no idea what your political beliefs were before we talked, and or your religion, but none of that really matters,
Yeah. I
and
believe in common sense. How about
yes,
that? And
right.
in our constitutional rights. I
Yeah.
don't I I think that when people start aligning with a party and have a disregard for who the person is representing that party,
Yeah.
all bets are off. Like,
Yeah.
you have to be able to look at a leader as someone who's going to, I'll recommend someone. I'll actually forward you. I'll tag you on it. I'll forward him to you. His
Okay,
name is
awesome. And I'll
his
put it
name
in
is
the show notes, guys.
yeah.
But thank you. Thank you so much for your time today, Mary. That's all the time we have for today, friends. You can go to Mary's website, heart to soul L or CW.com. Heart TOSOULCW.com. Thank you guys for listening. Make sure you share the podcast. Send us an email, nurses@americaoutloud.com. And until next time, friends, be safe, be well, and God bless.